I saw a big function where they have gotten now a Amboseli Park.
Did you make a request?
Sorry?
Did you apply for that?
Oh, we have written severally. We have written severally. In fact, the first proposal that was made by His Excellency, the President, was that you do 50-50 revenue sharing. We have raised that severally in the summit. They say we're still working on regulation, we're still working on, and I keep telling the Waziri, Rebecca Miano, you know this is English that you're giving us. We know how much the revenue of the park is. We should just send you a bill and an invoice. Because the park being in the city constrains a lot of other development. Remember, that is more than an eighth of our land. Even if we only charge rates for that entire piece of land, it is a lot of money. So that would contribute to what other counties are able to make. Our revenue is 13.8 billion. It is the highest historically ever collected. Even during the time when, I don't know who was asking about national government running the city. When NMS was running Nairobi, they only did, I think, 8 or 9 B. And they had everything, including the military and the bombs and the guns, but they only did 8B. As through technology and persuasion and, good analysis, analytics, data is helping us.
A point of information for the governor about the issue of Nairobi National Park in comparison to the Amboseli National Park. You know, Governor, you could charge the rates on that land. I don't know, you'll be charging the animals. But let me tell you, the wildlife from Nairobi National Park, the residents of Nairobi have occupied every space that would have been available for as a dispersal area for that wildlife. So actually, your wildlife are now, the dispersal area is in Kajiado, our pastoralist areas where our livestock should be feeding. So actually Nairobi National Park should also be handed over to Kajiado.
Chair, since Senator Paris and the Kajiado people have gotten something, they should help others also fight for themselves. Also think about your neighbor. We can discuss the animals later. Chair, let me go to other substantive issues. The issue of pension deductions. Chair, previously there was a lot of unremitted statutory deductions in the county. If you look at LAP fund, it was coming to, I think, 27 billion, and we've cleared the principal. We don't owe them anything in principle. We only owe interest. 6.6 billion interest. Chair, that committee that you set that met in Treasury, and I went and sat with them, is focusing on how the interest needs to be calculated. Remember, LAP fund is a DC fund, a direct contribution fund, and LAP trust is a closed fund, which is a defined benefit fund, a DB fund. Now, the RBA Act provides what percentage the interest must be, but we've been negotiating that we use the Treasury bill rate, which is at around 4%, which will bring down that interest. So I want to just make it clear that in our time, we have submitted all statutory deductions. We have not failed to submit from 2022, when I got in, to date. We are up to date. The problem is a historical debt of this 32 billion of LAP trust and 7 billion of interest. The interest can actually be reduced on a DC fund. But on LAP trust, it's very difficult because it's a defined benefit. And an amount also comes up called the actuarial deficit that we've been negotiating about what the actuarial deficit then should be if you're able to sort out that interest. Now, what we agreed, because I've given you the progress on this other amount of 67 billion, and the letter that I wrote then to the head of public service was that while we continue to fulfill our outstanding liabilities, the historical debt be paused, so that we can do either debt swaps or write-offs. What I don't want to do is what previous administrations have done in Nairobi, where our land, for instance, Mariakani Estate was given to one of the entities, LAP fund, the citizens, or then the rent goes up. Because these houses of ours really is a social thing, it is not for profit. There's no other place you'll pay rent of 3,000 or of 10,000. Now, once you commercialize it, into a transaction, then you disenfranchise that citizen. So we're looking at how part of that debt owed to us by national government, they can be able to take over those loans and sort it out. That is why I said we're at 86 billion. Our discussion is on 67 billion that they owe to us. Once that is dealt with, we'll come to around 10, and then we raise our charges. If you go out here, Arambe Avenue, all those parkings that are cordoned off, some ministries have been paying, some have not been paying. I must say there's been now an improvement, because the law that you passed said that for contribution in lieu of rates or silo or rates, instead of me billing every ministry or every national government entity, we write to the National Land Commission. The National Land Commission does one bill to Treasury, which we have done. My CEC wrote to them. We've, I think it was coming to, is it another 2.7 billion, and then the process of settling that as Treasury and putting it in the. I think now there's better, and I want to really thank the current, CS and PS. They are more receptive. Before it was very difficult, can't pay, won't pay mentality. But today you can see they are more receptive towards sorting out what they owe us. They've asked about the sub-counties. So on pension, we really want to, so it's very unfair. Someone has worked for years, they have contributed, they have given their service to our council, to the public, and then when they retire, they cannot get their dues paid. Nairobi Water had wanted to take a loan to sort out their debt, and we paused it. We said, look, if this arrangement, which unfortunately has taken long, of the national government and Embakasi Garrison is concluded, and we did the last meeting, it can cover all those debts without me giving up county assets or getting further indebted into loans. That we would not want to go that way. Chair, the issue of sub-counties in Nairobi that you've asked is a welcome move. Actually, we're the ones who made that appeal. Nairobi had 11 sub-counties in terms of national government structure, but 17 constituencies. And so there was a huge discrepancy in service delivery. You'd find there's one place called, the DCC of Njiru sub-county was all the way from Kamulu, part of Kasarani. Yeah, there's another DCC Kasarani. So this one is in Umoja, Kayole, up until Mukuru Kwanjenga. And so the person in Mukuru is being served by a DCC in Njiru. It was very untidy. And so what we've been able to manage, and I want to thank the national government because they listened to us, now we have 17 sub-counties. And so you have 17 DCCs, 17 in the structure that is aligning with the constituencies. They have created now new deputy or other county commissioners into 3 regions. Initially we wanted them to align with our borough system of 6, but they have settled on 3 for now, which for us is a welcome move, because one county commissioner dealing with 17 constituencies, 85 wards, and 7 million people is a bit also overwhelming, because we have a regional commissioner. Nairobi is a region as well as a county, a regional commissioner and a county commissioner. So that discussion is ongoing. We've had meetings, we've had to sit down. The last one we did, I had all my sub-county commanders of the security and compliance, my sub-county admins, my ward admins, together with the police, the OCPDs, the OCSs, and the NGAO, the National Government Administration Officers, and together they've even formed their own implementation units, because you cannot do this work alone. You must work together. So Chair, that is going on well, and we are grateful for the interventions made. Senator Kamara has asked me many questions, and I know you're very passionate about education. And I must thank Senator Kamara and the Education Committee, led by Senator Montet. When I came, I think 2 weeks ago, I got a lot of good advice, especially on the area of TVETs. And we're refocusing more resources. In fact, as soon as we left the meeting, I called partners. One of the senators, I think Senator Folamu, had raised an issue on Langata women's ECD. If I'm not wrong, yeah, he's the one who raised it. Immediately I called one of our partners to go do a review and look at what we can do to spruce it up. Chair had explained that I was once a student there in the prison, because my mom used to work there, and so when I was naughty and I didn't want to go to my school, she would carry me along to prison, and I'd go to that ECD. So we're sorting it out. We've also started on the Safaricom Foundation to look at how we improve these TVETs. I'll be calling upon my senator to assist me to do more public awareness on the courses that are available in our VTCs. Is it VTC or VCT? There's one which is for Nini. VTC, Vocational Training Centers. Because for a long time we've told people that when you fail exams is when you go to a VTC. So we discourage the youth that if you're going to a VTC, you're a failure. Yet the skills that come from VTCs, very few people who've gone through there are lacking a job. There are very few plumbers today who don't have something to do, or masons, or we are redoing some of the courses. For instance, now half of my vocational centers are doing driving courses. Instead of the bursaries paying for the private driving schools, they can actually pay our county, schools. The amount of money that we're giving through bursaries, there is now a provision that this specifically must go to our institutions to build those institutions. Some of the needs we have, for instance, uniform for our inspectorate, a uniform for our health workers. We have now said let them be made in Dandora, where we have that capacity. And so apart from ongoing contracts, we're now moving to actually utilize, because the enrollment has been very low. So I really want to thank the Education Committee. It is true, a lot of the actual development has been done through ward-based projects. The ward-based projects are still our projects as an executive, because there is no ward development fund. It is just ward-based projects where we identify. And so the committees in the ward, many of them have identified ECD centers to be put up. On top of that now, if you look at our supplementary, because after our meeting, I took note of what you said and I've included in the supplementary that is now before our county assembly. We have put in the issue of the playgrounds, not just in our schools, but in estates. And the playground is swings, merry-go-round, slides, monkey bars, and seesaws. We sometimes take for granted the impact of just one set of that within the informal settlements, where our children many times don't have nothing to play with. So we've incorporated that, and I'm very excited about that program. On health centers, I think we have not given, we need to update the information, because we've done quite a number of new of the centers, but really the work was to operationalize the ones that had been built. There were 19 new health centers. They had been at various stages of completion. Many of them didn't have the perimeter walls, etc., and they were still being handed over for maintenance. So we wanted, instead of building new ones, fully operationalize the ones you have. That includes employment of medical staff, nurses, doctors, clinical officers. And so it's not just, a hospital is not just a building. It is the equipment, the commodities, the human resource issues, the financing. I must say, Chair, that the Primary Health Care Fund and the Social Health Authority is the one fund that is doing well, or rather comparatively better. We have even small facilities. If you go to Pipeline, if you go to our level 2s and 3s, getting up to 2 million shillings, in terms of reimbursements. And in our level 2 and 3, we are not charging Nairobians a shilling. You walk in and walk out. Now, with that money that is going there, because we've had to now retrain those managers. Remember, they were not handling a lot of these accounts. We are taking them to School of Government bit by bit to understand, accounting and operating the finance. They are now buying their own medicine in those lower level facilities. Of course, it is not at where we want it to be ideally, but we've seen a great improvement. The example I'll give is Quarry Dispensary with now 1.7 million shillings. They're about every month, and it was just 2 containers. And now the challenge we have is the SHA reimbursements. I know there's a question in health that we owe KEMSA the biggest amount, which was 200 million. Has it gone down? It was 244. It is now 200 million. But I said yes, we owe KEMSA 200 million, but NHIF owes us 800 million. Why don't they deduct and give us a change? It is easier, because how are we paying you? We're paying you through provision of that health service. So yes, we owe you 200 million, but you owe us 800 million shillings at the national level. Do that. Yeah. How much are we owed now by?
Through you, Chair. I'm surprised the governor, everybody says SHA is working.
Yeah.
You've really surprised me.
by saying, I'm not saying it's not working, I'm saying they're delayed reimbursement.
Order, members.
Outstanding amount here, it's still working. But
order.
It's working slowly.
I know.
Chair, can I request that you ask the governor to give brief and specific